Welcome to Aging on the Suncoast. I'm your host, Jason Martino. Like previous years, the Medicare open enrollment period started October 15th and will end on December the 7th. This period is a critical time for Medicare beneficiaries to review and understand their Medicare coverage. To help consumers in Pasco and Pinellas counties, the Department of Elder Affairs SHINE program provides unbiased, free, and confidential counseling to assist beneficiaries make independent decisions in order to maximize their Medicare health coverage. On today's show, we've invited back two seasoned SHINE ambassadors. Janet Mills, the SHINE area coordinator, and Charles Frankel, the SHINE local coordinator, will help us understand where to turn for assistance, navigation, and other potential financial benefits. Janet, Charles, welcome back to Aging on the Suncoast.
Good to be here.
Yeah, we had a little break in our routine. We love to have you on every year to talk about all the cool things that we're going to talk about today, and really what you do on a daily basis, working with the area agency on aging. But COVID really got in the way, and we're happy it's dissipating in a slight way, and that we're able to kind of re-engage the public and do the things that we know. So let's set the framework for. CMS, the Centers for Medicare and Medicaid Services, they publish a handbook every year. It's called the Medicare and You Handbook. They have already put out in September the one for calendar year 2023, and it really sets the infrastructure and the policies and the regulations for what is available to people in calendar year 2023 and kind of the rules and regs that surround that a little bit. Any consumer is welcome to get that by contacting CMS, but we also have some on hand with our agency, and they can simply call our SHINE program and or the helpline and get a copy of that too. Today's show, we're going to cover a variety of different topics. All are very near and dear to you, and but let's start with SHINE itself. So Janet, I'd like to start with you. What is SHINE, and what's SHINE's mission?
SHINE is a free and unbiased program that was started by CMS because there aren't any Medicare offices some 30 plus years ago, and anyone can call us to navigate the system, and please do year-round. It is a wonderful program. We're all seasoned volunteers that participate in the program.
Yeah, and you're right. All year round is what you and Charles and your colleagues that are volunteers definitely work. It's a very heightened period for us right now. We just got done talking about open enrollment period. So what type of assistance do SHINE volunteers provide?
We provide information about Medicare Advantage plans, original Medicare, and we help with things such as billing or appeals, a lot of understanding of how health insurance works nationally and in the state of Florida. Yeah,
it's tremendous, and it's really totally run by volunteers with some guidance from some staff at the Department of Elder Affairs level and the area agency on aging on there. What kind of qualifications do volunteers generally have to become a SHINE volunteer?
Well, you have to love the fact that we get continuing education all the time, and you need a lot of patience. You like to work with detail, and you love helping people. I think that's the biggest reward.
Yeah. Would I go out of my zone by saying solving puzzles too?
Yeah.
I think that's probably a part of it as well. And the types of individuals that the SHINE volunteers serve, what does that look like?
It can be anybody. It can be a person who isn't able to navigate the system themselves. It can be a relative who is calling for somebody else. It can be a retiring or retired professional. It is a program that anybody can benefit from.
Yeah. Is it just relegated to people that are on Medicare, or if somebody was getting ready to get on Medicare, is that?
No, it can be people that are looking ahead to know what the system offers them. I had a client yesterday who was 50, and she was looking ahead. I wanted to say, I hope, and she said, I am a planner.
That's really proactive.
I know.
Wow, good for her. Mm-hmm. And how does one get a hold of the local SHINE program?
That is by calling the Area Agency on Aging. It's a statewide number. It is 888-963-5337. And you can reach the area agency and the Shine program. Oftentimes you don't get a live person, but you can leave the message and expect a return call. We try very hard to make those within 48 hours.
Yep, and I think we do a pretty good job. We served 6,000 people last year, and that's a lot, with the brunt of them being served in this 2.5 month period as well. Charles, I want to tap into some of your expertise. I'll set the table with the fact that, let's say that I am that 50-year-old that Janet had a conversation with, and I'm technically new to Medicare, but I want to learn everything I can possibly learn about it. So when I get to that age or that situation where Medicare is going to help me, how do I approach it? What do I think about?
Well, I'm not sure about the 50-year-old. Things may change a lot by the next 15 years.
That's what I told her.
But for anyone who's approaching 65, the first thing you want to do is enroll in original Medicare. That's the Part A and Part B. And you do that, for most people, it's through Social Security. You can go online and find out how to do it, or you make an appointment with Social Security to do it. In rare cases, it's through the Railroad Retirement Board if you work for the railroad. And if you have to enroll unless you're already taking Social Security. In that case, you're automatically enrolled and you have a choice of whether to take the Part B or not, but you will have Part A. There are also people who get Medicare because they're on disability, Social Security disability insurance, and that should be an automatic enrollment after 24 months. There are a few other cases, but Social Security for the most part is who you need to enroll with. There are instances, especially if you are working and have credible insurance with your employer, where you may not want to enroll. In that case, you will have an ability to enroll while you still have that insurance and are employed, or up to 8 months after you lose that. And you can do it without delay or without penalty. There are cases where you may want to enroll then as well. And these are things you can discuss with the counselor. But once you are enrolled in A and B, then you have a lot of choices to make as to how you want to take your Medicare. And we can also help with that.
Yes, I know you can. So I'm shifting gears. I called you a year before I was eligible, and I was new to Medicare at the time, and the Shine program really helped me understand everything I need to do. And now I'm enrolled into Medicare and I have a plan. And then open enrollment comes. And my good friends say to recontact the Shine program as well. What are the types of things that a Shine volunteer is going to help me now that I'm actually in Medicare and have a plan?
Well, we recommend that every year you review what you have because things change, plans change, drug plans change, Advantage plans change. But this is the time of year when you can make almost any change you want. You can go to a different Advantage plan, different drug plan, between original Medicare and Advantage plan. So there are a lot of choices that you had to make in the first place. And some people found it so difficult in the first place that they say, oh, I don't want to look at it again. But you really should.
Yeah, my grandma was a good example of that. I used to work with her to talk with the program in Washington State. They call it Shiva in Washington State. And I think she was fatigued with some of the, everything that she had to kind of go through before. But they really made it so easy for her. But I just think it was the process that people, didn't want to maybe procrastinate a little bit. So you're right. And speaking of OEP, Janet, tell us a little bit about OEP and that. Charles kind of hinted at some things. But
Right. And just to follow up on what Charles said, we're not selling anything.
That's right.
We are a program of education and advocacy. So once you've talked to us, as long as you would like to, then you can go to the plan or to an agent to make any changes that you might want to make. But yes, the open enrollment period is every year from October 15th through December 7th for effective January 1st of the next year. And those are the times when you can make those changes. And so we go over coverage and costs, and it might be a case of your doctor taking one plan or not taking another plan, and you need to make a change or you want to make a change. all of that can be discussed with us.
Yeah, I'd also add that you're empowering people. In addition to the advocacy that you provide, you're giving them so much information where they make that decision
Definitely.
for themselves. So OEP's here. That person made a decision to call. They got linked up with a counselor. What is that counselor actually doing with them?
Having a conversation, actually.
Yeah.
Discussing whatever needs they called about. That's where we're here to help.
And so walk me through it. If I was a new person and I'm complex like any other human out there, I might have multiple specialists in my life. I might have multiple prescriptions. I think the average for seniors to take these days is around 6 different types of prescriptions at that time. And I'm really interested. My income is low, and so I'm really sensitive to my budget and my co-pays and the cost of my prescriptions. If I were to have a conversation with you at that time, are those things that you would really take a look at to make sure that I'm picking the right plan?
Well, I'm just listening to what you just said.
And you're a great listener, too.
Yes. I always think if you're looking for a Medicare Advantage plan, which they all have networks, and you want to keep some of your doctors, then probably one of the first questions that needs to be answered is, what Medicare Advantage plans do your doctors take? Because almost everybody takes original Medicare and a supplement, but that's not always the case with the Medicare Advantage plan. And then I'm hearing you talk about being low income. There are some programs which we'll discuss later that can help you with your Part D premium and your prescription drug costs. And there are some plans or ways to navigate through the system that could be less expensive for you.
Yeah, and prescriptions too. I mean, that's a big part of a lot of folks' lives, and if they have that, they're
Absolutely.
always looking for different advantages out there to help them out. Anything to add, Charles, to what Janet talked about in my scenario?
Well, she gave a good synopsis.
She's a good listener, isn't she?
Yeah, she is indeed. But I think I'd just like to emphasize how much plans do change from year to year. And, that's why it's so important that you really do look. Because, for example, drugs can be a huge expense to a lot of people, and which plan you have can make a huge difference. And coverage and cost, deductibles, et cetera, plans change them every year.
Yeah, nothing stays the same. That's for sure. Janet, tell me, give me a brief synopsis of your best case where you were able to help somebody through Shine to save money, keep their prescriptions at a good level, and also their doctors.
By reviewing your prescriptions, whether you're on a Medicare Advantage plan or on a standalone Part D plan, you can save hundreds, even thousands. There is can be that much difference from year to year, and we can do that. The $35 insulins, which are coming into effect next year. If people don't know about that, that's a wonderful thing too.
You guys have so much knowledge. I'm so happy that you're on the show, and we're going to talk a little bit more about other ways that people can save too. So hang tight. Please stay with us while we take a short break. As usual, don't forget to have a pen or a pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center helpline, as well as the State of Florida Shine SMP website. When we come back, we'll dive into some beneficial financial assistance programs that can put money back into your pocket and help with the costs of prescriptions.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.
Welcome back to Aging on the Suncoast. During the first half of the show, Janet Mills and Charles Frankel helped us understand how the Shine program can help Medicare beneficiaries make critical decisions unbiasedly and for free. So let's continue this important discussion and look at additional financial assistance resources that can put money back into your pocket or help with the cost of prescriptions. Janet, Charles, welcome back to the second half.
Thank you.
You covered so much stuff that you do on a daily basis. It's so helpful for me to sit with you and ask the good questions so the audience can understand how they can help them. You've talked so much about the cool things that you do that I've asked you to come back to the show on the second half of the show. Thank you very much for that.
We were worried.
All right, so let's set the stage. There's a lot of individuals that come into our life through the Senior Helpline that are eligible for programs that are going to benefit them financially. Puts money back in their pocket, like I've said about 90 times, I think, today. And they just don't know about the programs, or they either screen themselves out because they didn't know that they were eligible for the program. So we're going to talk about two today. We're going to talk about the low-income subsidy, and Charles is going to handle that. And Janet, I'm going to talk to you a little bit more about the Medicare savings program. So Charles, why don't we start with you? What is the low-income subsidy, and what's its value?
Okay, well, it's also known as extra help. It's something you apply through Social Security.
Yeah.
And what it does is it helps with the prescription drug cost. And it works in conjunction with your Part D Medicare drug plan. It can eliminate the deductibles. It can lower your co-pays. It's a tremendous benefit. Not only does it lower your cost, it makes it possible for people to buy drugs they otherwise would not be able to get. So I think that's just as important as the lower cost. If you can't afford it, you don't get it.
Yeah.
And it's there are different levels of it. So depending upon your income and assets, you get a different amount of help. One of the things the Income Reduction Act did, though, is in 2024, it's all going to be at the highest level. So everybody will get the full help coming then. But next year, it depends on your income and assets as to how much help you get.
And is that the type of individual that's generally eligible for the program? It's based on their income and their assets?
Yes, it is. And this is one thing we want to emphasize, that although there are income and asset levels that you have to do, there are certain things that are counted and some things that aren't counted. So don't, rule yourself out just because you think, oh, I'm above that particular income level. Well, in fact, you may well be eligible. And one of our mottos is, if in doubt, fill it out.
Yeah.
You have nothing to lose by applying. And it's a very simple process, and we can help you do it.
I love your motto on there as well, and I do. I think that sometimes people they make some assumptions about what they're eligible for and not, but really there's a lot of particulars in there that that maybe not be well known until they can talk with somebody, like a Shine volunteer. Can a Shine volunteer help with these low income subsidies?
Absolutely, especially this one's very simple. It's there's a simple online application. If you're on the phone with us, we can do it with you right at that point. And send you all the information later. It takes maybe 3 weeks before you hear back as to whether or not you've been accepted into the program. For those who are unable to do it that way, there is a paper application. It takes a little longer to process.
Yeah.
But very short, very easy.
And is Charles Frankel, are you determining the eligibility, or?
No, we just help you do it. Social Security will determine it.
Yeah, and they get back in, I think you said roughly around 3 weeks or so, but don't quote me on that because sometimes things get away and things happen like that. What a cool program, and what a good reason to have that program available. So Janet, let's talk about Medicare Savings Program. What exactly is the Medicare Savings Program, and what's the value in your opinion?
That you apply for through the state of Florida. And there are 3 levels of the program, depending on your income and asset level. And we can also help you apply for those programs, absolutely. And when they come time for review, we can help you to renew them. And it is a simple process, takes maybe 15 minutes to do, and then we can mail you the application for your signature, and then you mail it back for processing, and that takes 30 to 45 days. And if you are approved, then the state of Florida is going to pay your Medicare Part B premium, and maybe even more if you qualify at the highest level.
Yeah. So if I'm a consumer new to Shine, should I know about these programs beforehand so I can tell you I think I'm eligible, or will you all ask just good questions to find out if I'm potentially eligible for some of these programs?
Well, we try to treat our responsibility to help people to the fullest, and we don't have to be too specific, but we can mention what the parameters of qualifying for both programs are at the time, and it may change the whole conversation about how we look at different health care coverage for people.
Yeah, I bet you have some really complex conversations with consumers over there, and just because I know you as good listeners, we talked about that in the beginning of the show, you really extrapolate a lot of different things that are probably getting the brain pumping and figuring out different options for them to do at that time.
But I might just mention another benefit of these programs, and that is if you did not enroll in Part D, for example, or Part B when you were first supposed to, and you're eligible for these programs, it might eliminate that penalty. It also allows you to change your plans during the year more often than not just during the open enrollment period.
Those are
so those could be very good benefits for someone.
Those are great points. Thanks for raising them, Charles. For the Medicare Savings Program, typically what type of individual is eligible for those programs?
It can be a single or a married couple. If you are separated in the state of Florida, you're considered single, I'm told, and so that would be your income and asset qualifications would be based on those of a single person. But it's again what Charles said, if in doubt, please call us and we'll help you to apply. Because even if you were not qualified in the end, there's no black mark against you for having applied at all.
Yeah, why not?
No.
Yeah, nothing ventured, nothing gained, for sure. Janet, I'm going to make the assumption that because Charles didn't determine eligibility for the low-income subsidy, that you're not determining eligibility for the Medicare Savings Program?
No, I refer to my role as the helper bee.
Who does determine eligibility for that program?
The state of Florida,
Yeah,
Department of
Florida.
Children and Families.
Good. With big responsibility for him. So now we're going to talk about not necessarily financial assistance so much, but another program that we hold near and dear. I refer to it as an acronym, and I apologize to everybody for that. I live in a world of acronyms, and sometimes I break it down. But Charles, let's talk about the Senior Medicare Patrol Program, what I affectionately call SMP. What is it?
Okay, well, this is a program that Shine in Florida is now the ones who do. It's what we do is we try to help people with Medicare fraud and abuse. What we want them to do is detect it, protect themselves from it, and if there is something, report it. And if they need help reporting, we can do that. And this is something that costs, Medicare itself is estimated $60 billion a year.
It's crazy.
But furthermore, people say, well, that's Medicare, that's not me. Well, you may be hit with some huge copays that you aren't aware of because of this, and it may be difficult to get reimbursed for that. So it can be personally very costly as well as to the system.
Yeah. Now you mentioned the terms fraud and abuse. What is fraud and abuse in your eyes?
Okay, well, they're really the same thing in terms of what happens. It's, well, you're billing Medicare for something that you shouldn't be billed for, either overbilling or just billing for a service that's never really been provided. The difference is abuse is it's not intentional. Fraud, it's intentional. As a Medicare beneficiary, it's not up to you to determine whether it's fraud or abuse. What you want to do is, if it's either one, make sure that someone's aware of it. And there are people who will determine which it is.
Yeah, and sometimes it's possibly just as simple as helping people understand how to read their explanation of benefits, what we call the EOB, just so they can kind of take a look at some of the itemized things on there to figure it out.
With original Medicare, you get an explanation of benefits, or if you have another insurance company, look at that. See if it's really a service or a doctor you went to or time. If it isn't, one thing you might do is just call the provider, and they can explain it to you. Well, we sent this out to another lab. That's why you don't recognize it. Or, oh yeah, we shouldn't have billed you for that, and just fix it on the spot.
Yeah.
If not, then report it somewhere else.
And like you said, Charles, the Shine volunteers that are helping people navigate Medicare, helping them make good choices for their healthcare coverage, helping them with the low-income subsidy, helping them with Medicare savings program, they're also doing the SMP program. They're so valuable to our agency and to our community. I can't imagine what else they would do. But typical to volunteers, they volunteer and put their time in when they can, and they put it in as strongly and as committed as they possibly can. But we're always looking to take on new volunteers. So let's talk a little bit about volunteers. I said earlier that last year the volunteers that work with our agency, the SHINE program, the SMP program, they serve 6,000 people that reside in Pinellas and Pasco County, mainly seniors on there. In an attempt to recruit more so we can even serve more people out there, what type of qualifications does a normal volunteer bring to the table, Janet?
A person who is interested in actively helping people and who loves to learn. There are new things to learn all the time. Things change. And again, you need to have a lot of patience. And it's very rewarding. And we have a wonderful group of volunteers. There's camaraderie and teamwork, friendships develop, and it's a wonderful program.
It's one of my favorites, that's for sure. And what can a potential volunteer expect?
There's a lot of training that goes into becoming a SHINE volunteer. Initially, it's online training, and then it is a day of togetherness, so to speak, for the last module, and there's testing at the end of that. And then there's mentorships that volunteers work with people until they feel comfortable working on their own. And I must mention that Charles is the trainer for our area. He's a state trainer.
He's a statewide trainer, and I was
Yes,
going
he
to tap
is.
into that a little bit as well. What does that training process look like, Charles? And I didn't mean to cut you off. Sorry, Jan.
Okay, well, Janet's already gone over some of it, but now there is an online, there are 8 modules for different sections of the Medicare, from original Medicare to the drug plans, advantage plans, financial, all the different things. And then there's a 9th module, we call it, which could be a on Zoom with a trainer. And in that case, it's kind of a 3-part training, and you may have your mentor to be with you at that time. Or it could be a 1-day in-person session. We're starting to do that a little more again now that maybe we're getting a little more, it's not over, but I'd say used to the COVID.
Yeah.
But, it's pretty intensive. And then there is as Janet mentioned, some testing after that you need to pass. And then there is screening for fingerprints and so forth. And then you get into the mentoring, where you are paired up with a seasoned volunteer, and you go through mentoring sessions with them. And that kind of lasts until both you and the mentor feel you're ready to go on and try it on your own.
I really am so excited that you came on the show again. I'm very sorry that it took so long. There were some things out of my control, but I'm very happy that you're back. And Charles and Janet, thank you very much for being here. Yep.
Good to be here.
We hope you enjoyed this month's broadcast. We also hope this episode sparked your interest to contact the SHINE program in order to seek help during the open enrollment period. Please remember, this critical period ends December the 7th, so start the process now. We'll see you next month, and until then, please make every attempt to maximize these free and exceptional resources.